Valley. Silvana runs them. She's a great resource for figuring out, how to get more involved in your community, how to get more involved in local projects around homelessness. Also, Corinne, who introduced herself, is another great resource for that. So want to make sure that if it's your first time, try to make sure you connect with Silvana so you guys can learn more. The purpose of today's meeting is for both the Los Angeles Homeless Services Authority and for Los Angeles County to collect your input on how we fund the homeless services system in the years to come. Ultimately, there's a lot of different sources of funding that come in through the homeless services system, and we can, dig through all the details of those sources of funding, but we know that at the end of the day, most of you don't really care about what the sources of funding are, right? You care about how the money is being used and how it's being used to get people into housing. So that's what we're going to talk about today and really hear from you is what are the interventions that we need to be investing in, what are the gaps that we're not investing enough in, and what are some of the changes we need to see in programs and service delivery. So I'll start, we're going to try to keep this presentation really short and use as much of the time to break out into groups and actually talk through what input we need to hear from you about what you're seeing in the community. Ultimately, we can't design a system, we can't put together interventions without your input of what you're seeing in your neighborhoods. So I'll talk a little bit about the homelessness crisis, we'll talk about the system structure, what are the sources of funding we're actually talking about today, but then most of the time we're going to spend actually doing the input and having conversations with some of our staff and with each other in a breakout. So what's prompting this is that over the next 6 months, both the county's homeless initiative as well as LAHSA are making recommendations on how a bunch of different sources of funding should be used. The largest of those sources of funding is Measure H. And later in the spring of 2020, the County Board of Supervisors is going to make some decisions on how Measure H should be allocated. So it's really important that before we do that process, that's informed by service providers, community members, people with lived experience of homelessness, other government officials that work for partnering agencies like the City of Los Angeles or like LADOT. And so we're having sessions like this in all 8 of the county's service planning areas. I was just at one this morning in the San Gabriel Valley. Now I'm here with you all. So that's why we're doing this. Just as a reference point for where I'm at, this is my favorite thing to do, is to be out here and hear from you all. I meet lots of different people that I wouldn't have met otherwise. Just a quick overview of our homeless system and our homeless crisis that we're in right now. So this slide on the bottom of page 2 is, I think, really like the most critical slide, because that's what we're dealing with and that's what we're seeing on the street every day. Before we actually talk about the number of people that are homeless, we have to think about the fact that there's hundreds of thousands of households in Los Angeles County that are paying over half their income on housing every month. There's a lot of different reasons that people fall into homelessness, but this is at the root of what we're dealing with. Is, the reasons that people are falling into homelessness are diverse, but all of them ultimately boil down to housing and that it's hard for folks to afford their housing. So that leaves us with a number of these people actually falling out of their apartments, falling out of their rent-burdened housing situations into homelessness. In 2018, when we conducted our point-in-time count, which is just a snapshot in time, it's not an overarching, census of all homelessness throughout the year, it's just a snapshot. That snapshot showed about 53,000 people experiencing homelessness. Over the course of 2018, another 55,000 people, we estimate that another 55,000 people fell into homelessness over the course of that year. So ultimately, during the course of 2018, over 100,000 people were homeless in Los Angeles County. Now we're pulling people out of homelessness. 21,630 people were housed through LA County's homeless services system. another 27,000 people were housed largely on their own. They were largely able to resolve their homelessness with a minimal touch from the homeless services system. But even with all those people being housed, as we see, more people are falling into homelessness faster than we can house them. And so that's why in 2019, our homeless count snapshot, again, just a point in time, that snapshot showed about 59,000 people experiencing homelessness. We're housing more people than ever. Some parts of our system are working really well, but ultimately people are falling in faster than we can house them. This is just a quick overview of kind of what it looks like by each service planning area. So SPA 2, that's where we are in San Fernando Valley. Approximately 8,000 people experiencing homelessness in our 2019 count, and that's about a 3% increase from the previous year. For those of you that are, work in our system, you probably have a good sense of how the system looks. I'm at the bottom of page 3 here on the handout. The way our system works is there's funding coming in from multiple different sources. There's federal funding, things like Section 8 vouchers that are devoted to homelessness. There's the Continuum of Care program, which is a HUD program. There's also local funding. So the county Measure H, that's the largest source of local funding, but there's other sources of local funding as well. City of LA puts some funding in. And then there's state funding. That's kind of the new player on the scene. State was largely absent from funding homelessness up until last year, and now they've begun to play a larger role. All of this funding goes into what we call the coordinated entry system. And the coordinated entry system is not, don't think of like a database or anything like that. It's just a way of pooling our resources and connecting people to the appropriate intervention as efficiently as we can, and in accordance with what intervention makes the most sense for that person experiencing homelessness. What that means is there's different strategies within the coordinated entry system. So for one population with really severe needs, a strategy might be supportive housing, which is deeply affordable housing with wraparound services. For another population, like maybe somebody who just lost their job, wasn't able to make rent that month and was evicted, they might need a voucher or a rapid rehousing voucher where it's a time-limited financial assistance paired with case management. For somebody else, it might be homelessness prevention and doing kind of a quick hitting intervention to get them before they actually fall into the system. For all of those strategies, there's different county departments as well as LAHSA, because LAHSA is a joint powers authority of city and county, so it's a little different. There's different departments that actually administer these strategies. So funding goes through the coordinated entry system to different departments. Those different departments then contract with community-based service providers like LA Family Housing that are actually the boots on the ground doing the work. So it's not the most clear, straightforward system, but this is what our system looks like. And then I'll have Bill talk a little bit about Measure H.
Sure. Hey, thanks for having me, everybody. I'm Bill Taylor again with the Chief Executive Office for the County of Los Angeles, and we have a small team there downtown that helps coordinate and facilitate with all of the other departments in the county, and then with agencies like LAHSA and a lot of other providers, this system that we're putting together and that's continuing to evolve. Just before I say a couple words about Measure H, I encourage you throughout the next couple of hours while you're floating around and questions arise, you all have this PowerPoint, and I'm sure it's very high level. A lot of information is here that we touch on, but if you have some specific questions that you want to grab us on the side and ask, please feel free to do that. That's kind of why we're here too. How many of you have heard of Measure H? Perfect. So like Alex said, we're using this session in SPA 2, one of 8 around the county, and one in each SPA, and we're money's green. So Measure H, whether that's local tax dollars or whether it's state dollars that are coming down that are new, like Alex referred to, it funds the system. And so we're trying to maximize that with your input. We're trying to get a feel for what SPA 2's priorities are. Measure H, as you know, this might be a little review. It was passed a couple of years ago. It's a 1/4-cent sales tax across the county, and it generates about $355 million a year. It's been a little bit over that because of revenues are high, the economy's good right now, and it's for a 10-year period. So it would lapse or sunset in 2020. What year would it be? 2026? 2027. You see on this slide here that to date or originally when we set out with this ballot measure, we projected that 45,000 families and individuals would move from homeless to permanent housing. And in the first couple of years of Measure H, we have about 16,000 that have been permanently housed. So we're on a good clip. As Alec said in one of the previous slides, is that inflow, people are entering homeless at a faster rate than we're able to permanently house or move them into temporary housing. So we still have this kind of evolving system and a growing problem. I'm gonna leave it at that.
Glaring question. So you say that it was voted in March 2017.
Mm-hmm.
When did it actually kick in? In other words, when did the consumer actually started paying the tax?
So October was the first month. October of 17 was when actually the tax went into effect and began to be collected. And so the system really didn't ramp up until around that time, shortly after that. Once we knew that it passed, we were already ramping up the system with existing dollars, and a lot of planning was taking place. So that there was a little bit of a delay there.
So according to what I hear Alex correctly, this tax came into effect only in 2019. Is that correct?
2018.
2018. Okay, all right, okay. So what I was thinking is that, well, what happened to the accumulated funds that were in the interim not particularly used? Was that given to the homeless, or was it used for something else?
There's been no I'm trying to understand the question. There's been no accumulation of funds from Measure H that haven't been allocated through our funding deliberation process. This is the second big community outreach. Every year we reach back out to the community to try to get a feel for how things are evolving and how things are going. This is our next 3-year funding cycle where we're looking for community input in order to look and project where do we want to allocate and budget these dollars into the system and for over the next 2 to 3 years. I'm going to keep going through this, and if you have questions on the side, I mean, I'm more than happy to kind of grab you on the side.
You just tell me successful things. In other words, you're talking about money.
So
just tell me what's working.
So actually, the purpose of this is not to go through outcome report in terms of the data across all the different strategies. What we want to know from you at this session and each of the other SPA sessions is what you need in your community, what you think is working well from where you sit, whether you're a provider, a council member, a community activist, advocate. What do you think is working well from your perspective? We want to hear that. There's other parts of the funding process where we're getting community input, and we're going to touch on that in this slide, where you have other moments in the process where you're going to be able to provide. We want to hear your input.
So if you guys mind, if we'll save questions for the end, because it might be that we're going to cover some of the things that you're asking about at the end, and we want to save as much time as possible for you to have these conversations in the input sessions so that we can really have that robust dialogue that I know you all are eager to have.
Right, because I would encourage you to channel some of the questions and concerns you have may be fits for some of these stations where we're trying to put or bucket this input that you're going to give us. If it's separate from that, after we present and once everybody's milling around, putting stuff on Post-its, we can, like Alex said, entertain some questions. So on this slide, the flow of Measure H funding is similarly programmed to the way that Alex described other funding, where Measure H funding comes into the county and it is contracted or through different departments. For instance, like LAHSA is one agency that we have agreements with, and then they in turn contract with providers that are out in each community that cover different interventions. Those providers sometimes will subcontract with other ones in order to reach all the subpopulations across each of the spas. Department of Mental Health is another department that gets a significant amount of funding to focus in on those types of interventions. Department of Health Services is another one. All the departments, whether they're funded or not, are very involved in Measure H funded interventions. And
I just want you to know.
So I'll
by
pass
your
it to you.
statistics, we were just talking about it.
If
I
we could
wanna
just,
know, no, listen to me, please.
I wanna make sure we get through the
I'll
presentation.
stand up, ready? 355 million.
We're not giving you the room, sir.
Go ahead.
We can
$22,000
all
a
respect
person.
each other.
so we want to make sure we hear from everybody, so we'll make sure that we get to talk. So just to give a quick overview, because we're not just talking about Measure H, but we're also talking about state funding. So in June of this year, Governor Newsom and the state legislature agreed to allocate about $640 million statewide for homelessness. That's funding is being allocated to the big 13 cities around the state. It's also, there's a bucket of funding going to all continuums of care. LAHSA is the lead administrator at the LA Continuum of Care. We anticipate that, we're still waiting for allocations from the state, but we anticipate that the LA COC is going to receive about $67 million in state funding. The counties, the 58 counties around the state are also all being allocated funding. And so we anticipate that LA County will receive about $65 million in funding. Governor Newsom and the legislature agreed to keep the funding basically as flexible as possible. So that means things like homelessness prevention are eligible, supportive housing is eligible, rapid rehousing. Really, most of the programs that we already do through Measure H are eligible for funding. The only real restrictions on this funding are at least 8% of every award has to serve homeless youth. And the other caveat is that we have to spend it over the next 5 years, with a benchmark to ensure that about half of that money is spent over the next 3 years. Bill, do you want to talk about the major lines of funding for Measure H
Yeah.
to give context?
so on this slide, you actually see 5 different major intervention buckets, program types. So as you can see, prevention, it had this is in this current fiscal year that we're in, 23 million of Measure H dollars out of the total was designated for strategies that provided prevention-related services to families and individuals. Outreach had 29 million, permanent supportive housing 77, the heavily funded rapid rehousing model, which is shorter term housing than permanent supportive housing, which has a lot of intensive wraparound services. The rapid rehousing is funded at 85 million, and your shelter, or otherwise known as interim housing, at 126 million. Just to point out, obviously the math, 460 million allocated this year. That's a lot higher than the amount that I mentioned earlier, which was 355 million, which was our annual Measure H estimate. That's a combination, the increase to 460 million is a combination of the early years, the first couple of years, as you can imagine, ramp up across the system, the hiring of hundreds and even thousands of staff in these different area modalities, contracts that were being developed in order to roll out these services. took a while to build the system, to build it out. And so that money was deployed with public input every year through the Board of Supervisors deliberation process to the different strategy areas that are these interventions. And so I'm just gonna step back. What you see here, actually go back to that. What you see here is dollars deployed to big buckets of types of intervention. But within each of these interventions, there's a customization that goes on to meet the needs within that modality of individuals and families, or youth, or domestic violence, or senior populations, or LGBTQ, or so there's specialties within each of these that are accounted for in the detail. And as you'll see over the next few months, kind of culminating into next year's allocation recommendation based on all the feedback that we're getting here to the Board of Supervisors, there's more detail underneath these numbers. I totally get it. You probably have 100 million questions related to this. I'm going to leave it at that for now and invite you offline or separate once people are kind of activated here to ask me questions if you have some.
So, all right, so now we get to the fun part where I get to stop shouting at you all and you can all come talk to us and we can actually have these conversations. So what we're gonna do is in just a couple minutes, we're gonna break out and folks can float to different stations. We're gonna have 6 different stations to take input on different types of homelessness interventions. The 6 stations are going to be, we're going to have a station on homelessness prevention. And that's going to be, I think, back there. Yes, back there. And again, there's going to be a LAHSA or a homeless initiative staffer at each one of these. And so they all work in the system. It's a great opportunity to ask them questions, to give your input. The next station is going to be access and engagement. And so that means things like access centers, things like access points, also street outreach, and what you're seeing or not seeing in terms of outreach being done. Jose, who is back in that corner, is going to be taking your input there. The third station is services. That's going to be on this wall here. And so services, that's a broad word. So services could mean employment services and getting people reconnected with work. It could mean wraparound services that are being provided with supportive housing. It could mean benefits advocacy and how do we get folks, hooked up with SSI or food stamps and increase income and increase those supports. Another station is interim housing. That's going to be there. What do I mean by interim housing? Interim housing means what we think of as shelter. So that could be the winter shelter program, it could be crisis housing, bridge housing, other modalities of shelter that maybe we're not seeing in our system. So that's going to be over there. That 5th station, that's where Matthew is waving to you. Thank you for waving, Matthew. That's going to be subsidized housing. So that could include, Section 8 vouchers, supportive housing, other subsidy programs like our rapid rehousing program, that'll be there. This last station here where Tracy and Maggie are standing, this is our other considerations. And so that's kind of a broad bucket. That could be, how does our system coordinate with cities? It could be, how does our procurement process work? How does the administrative rate on funding work? How do we do community engagement? All of that can be at this other considerations station. So at each of these stations, we really want you to think within like 3 kind of broad overarching questions. And obviously these questions are just guiding, so don't feel too bound by them. But it's what's working well that we need to build on? What are the successes that need to grow? 2, what are the gaps? So who's not getting served? What services do you not see that we need to invest in? And then 3, what are maybe the program design or service delivery changes that you need to see in existing services? The way we'll be taking feedback is, again, you're welcome to converse with the staffer that's there. They'll have sticky notes for you, so you'll be able to write your feedback down on the sticky notes and put them up on the wall. While you're doing that, they'll start kind of sorting by themes. we'll do that for about 40, 45 minutes. We'll come back together for a few minutes and we'll share out. So we'll hear from the station facilitators of kind of what were like the 3 or 4 most widely said things that they heard at that station. And then while that's happening, we're gonna distribute out some dots, some sticky dots. Everyone's gonna get a strip of 6 sticky dots. And that's a chance for you to then go and kind of echo what do you feel is the most important thing that you're seeing at each of those stations. So that's just kind of another layer of our input. I'll take a question in just a minute on the process. And we'll do that, and that's another chance for you to talk with people, see like, okay, I don't quite understand what this sticky means, what does that mean? That's why that staffer is there to help answer the question. All throughout, while this is happening, I will be kind of floating around, and I'm happy to answer any questions, especially if there's things that don't fit within these buckets. Same with Bill here, he'll also be floating around, so we wanna make sure we have those conversations with you, so please come find us if anything's not clear or if there's feedback that you feel like doesn't quite fit into these buckets. There's other opportunities to give input, so there's a couple links which will be emailed out. I know like copying down a hyperlink is a crazy thing to do, so we're gonna so make sure you've signed in, so we'll e-blast out these links to these online surveys, because I'm sure many of you know people who couldn't be here today. We want to hear from them too. So we'll make sure, so we'll send that out. There's going to be, on the Measure H side, a draft recommendations based on these input sessions, and there's going to be a webinar that the county releases in March, and more input on those draft recommendations coming in March. It's not on the slide, but on our side, I know we're putting together kind of a summary of all the feedback we heard, and we're gonna send that out to the community in December, so keep an eye out for that. Everything that you say today is gonna be recorded and is going to be seen by LAHSA staff, is going to be seen by county staff, read over and considered. So if your sticky note doesn't get all the dots in the world next to it, don't worry about it. It doesn't mean it's not gonna be seen, it doesn't mean it's not going to be considered. So that is kind of the broad strokes of things. Before we break out, again, I want to maximize the time we can break out. Are there any questions about the process for taking input? Yes, Tim.
So, how many sticky dots should I put on each station?
That's a great question. Thank you. So you're gonna get 6 sticky dots. We don't want you to put kind of like all 6 next to one thing, and that will confuse us. We hope that you'll put 1 at each station. We know that some people work more deeply in some sectors or have greater understandings of some sectors than others. So you can put up to 2 of your sticky dots at each station. I'll explain that again when we distribute out the dots though. Any other questions about kind of the process and what we're doing for the next hour and change? Yes?
I'm sorry, I just have to say one thing, which is if people are curious about what is going on and outcomes and success stories, you can go to LA County Homeless Initiatives. Every quarter, all of the departments and everybody doing stuff around homelessness reports all of their outcomes, and there is a quarterly report that goes to the Board of Supervisors, and that is posted on their website that has all kinds of outcomes, success stories, pictures of people we've helped, etc. I just wanted to do that.
Great, thank you. And that's, you can find that report on homeless.lacounty.gov. Homeless.lacounty.gov. That's the county's homeless initiative website. It has these quarterly reports which have all of the outcomes, really gets in the weeds, also has the high level. Thank you, Libby, for pointing that out. Any other questions about like process and kind of what we're doing here today? Yes?
How many stations can we float around to the different stations?
Yes, we hope you'll visit all 6.
And then also, if we have serious questions after, or we have time after we've given feedback about the stations to actually ask questions that really mean something to us. before-
Yes, but also I want to be clear that Bill and I are going to be available
It'd
for
be good to
all
do
those
it in
sorts
front of everybody
questions.
so that we can hear each other. It's so valuable that we have so many incredible people here.
We'll see if hopefully we'll have time for that. Are there other questions about the process and before we break out? Okay, great. So please go